Good morning, everybody. My name is Brianna Cardenas. I'm going to share my screen really quickly so that way you guys can see my slides. Give me just a moment. And then if you guys can give me a thumbs up or a tech team in the chat, let me know if this is coming through. Let me go ahead and share this. All right, and that should be coming through now. Right, let's close that. Thanks for bearing with me here. Okay, I don't know, it started all the way here. Okay, perfect. I think we're good to go. Right, welcome everybody. I'm going to be sharing my diagnostic odyssey from both sides of the exam room. My name is Brianna Cardenas, like I said, and I'm a physician assistant and certified athletic trainer with an additional doctorate in medical sciences. My clinical specialty is in chronic pain management, and my medical practice is called Healed and Empowered, where I specialize in treating people with hypermobility and comorbid conditions. I tend to take a holistic approach to pain management, and I offer manual therapy for patients that are seen in person, since I see people both in person and online. And forgive me if my voice is a little bit scratchy. I tested positive for COVID yesterday, which is why I'm not there in person. So apologies if it's a little bit difficult to hear me. I'm going to be sharing the timeline of my diagnostic odyssey. Um, First, I'll share about my hypermobile EDS because I tend to think of my health in such a way that there's the hypermobility chapter of my life and getting that diagnosis, and then the spinal fluid leak chapter of my life, which we'll get into in just a second. So my pain really began at age 11. I was a little bit heavy set as a child growing up. So I think the most simple and easy thing for a lot of my healthcare providers to do at the time was to blame knee pain on my weight. I also played softball, and as a catcher, you're kind of like squatting up and down repeatedly. So went to physical therapy and was told, hey, it's just because you're heavy and doing a physically intense sport. But over time, I started having more things happen. So, like during a softball game, I swung the bat and my shoulder dislocated when I was 13, and that kept happening over the next year. So, I ended up having surgery at age 14 for my left shoulder. I then ended up having knee surgery at age 18 on my left knee and woke up with the most severe back pain I had ever felt. It turns out that my SI joint, which is where your spine and your pelvis meet, was essentially subluxed during the transfer. Off of the surgical table back onto the hospital bed. So essentially, I was told that that was a psychosomatic issue by my surgeon. Um, I was prescribed opioids at that time, so I just took opioids all through college because I just didn't really know better. And I continued to take those medications until I turned 20. And then during my athletic training rotation with a physical therapist at a well-known rehab center in our area in Southern California, my preceptor who was supervising me on rotation basically noted that I was limping and had, a lot of back pain, and figured out that my SI joint was subluxed and corrected it for me, which was magical to have some pain relief. But during that treatment, he noticed that my joints were globally hypermobile, and he's actually the person who helped get me on the path to diagnosis. Um, I am somebody who has the privilege of being relatively functional through my schooling. So fortunately, I was able to just kind of deal with the pain and not have too much of my life impacted by that pain for the majority of my schooling, despite having 5 more surgeries on my joints and on some like oral cavity issues between age 20 and 24. And fortunately, like I said, I felt, you know, relatively functional still. But my fifth surgery out of the ones that were listed, it was my second knee surgery. And that was in 2014. And I woke up with brain fog that just never got better. Um, and I think, as many of us who have experienced medical gaslighting often do, is we convince ourselves that, this is just how it is, or it must not be that bad, or this is just getting older, right? There's all these excuses that we kind of make for ourselves when we've been told that nothing's wrong with us for so long. So I just figured, okay, I've, had anesthesia several times. That brain fog is just a part of life now. But I began to continue to get more and more sick over the next several years. So the following year in 2015, I gained 40 pounds suddenly and started having constant nausea, constant headaches, to the point where it was affecting my ability to work. In 2016, I would start to lose my cognition and vision, specifically in the second half of the day, and developed POTS that year. And my craniocervical instability got really severe that year as well. Um, During this time, I was told by uh, one of my members of my medical team to get off of birth control to figure out why my hormones were also all over the place. And unfortunately, had an unexpected pregnancy and subsequent miscarriage in 2017. And that is what I tell people kind of took me from being functional with what I now know was a spinal fluid leak to not functioning at all and feeling like impending doom, unfortunately. So during this time, I had seen about 15 different specialists. And I had responses ranging from total gaslighting, right, telling me that there was like absolutely nothing wrong with me, to blaming my problems on my weight, to one of my favorites was being told I had Hispanic panic. And that is something that it's just kind of horrifying that that's still, stuff that's said to patients in this day and age. It's pretty alarming. And so in 2017, I continued to have kind of this myriad of uh, symptomology occur where I ended up losing sensation in both of my legs. I needed to use a walker eventually. And I had kind of decided that in order for me to figure out what was going on, it was going to be kind of up to me to figure it out. And so I had already had experience reading MRIs in an orthopedic and pain management setting. So I pretty much spent that whole year learning neuroradiology and eventually figured out that I had a spinal CSF leak. And so I uh, Googled all of the authors who had written papers on spinal CSF leaks and found one near me. And ultimately ended up going to that hospital and saying, hey, I figured it out. This is what I have. Fortunately, I was taken seriously. And then, um, I entered the stage of getting treatment for this, which consisted of back surgery. And ultimately, I had 23 procedures in my spine from 2017 until 2021. The treatment for spinal fluid leaks is called an epidural blood patch. So I ended up having 23 of those. I spent a long time in the hospital in 2017 and 2018. And then fortunately, I continued to get better between 2017 and 2021. I feel like each blood patch kind of helped me, 5 to 10%. And cumulatively, that got me back to a place of being able to go back to work and be relatively functional. And in 2022, I actually found fascial counterstrain, which is a manual therapy. And this modality, experiencing it as a patient, ended up giving me back my quality of life. And I haven't needed a blood patch or any type of procedure since finding this modality. And I really do credit it with improving my health pretty significantly. So one of the things that I'd like to bring up when we talk about barriers to care and different issues in the diagnostic odyssey is that even for me, as somebody with multiple degrees in the health sciences, right, it took 9 years to get diagnosed with hypermobile EDS. And I think the only reason that I got diagnosed with hypermobile EDS was because a colleague that ended up diagnosing me is somebody who I spent 5 days a week with for 6 months. So I think to myself, how many appointments or outpatient visits would it have taken for me to get that much time with a physical therapist? I feel like it would have taken years. So I'm very fortunate that I had that level of access to a healthcare provider who knew what they were doing. It took me 3 years to get my CSF leak diagnosed. And, I'd like to point out that, again, I diagnosed myself, and my boss is the person who gave me a free MRI, since the neurosurgeon who I saw told me that I had a psychiatric issue and totally gaslit me. And my insurance wouldn't cover me getting another MRI because of that because of that neurosurgeon's report. And so fortunately, my boss had access to an MRI and let me just go have an MRI. So again, that's not access that most people have. At the time, I had two of the medical degrees. I had my athletic training and my physician assistant license. I had several colleagues that I was able to just like text neurosurgeons and text pain management doctors. And like, that's not something, again, that most people have that level of access to care. And I also knew radiology, right? I knew spine and joint radiology. So I was very fortunate to have that level of access and background to be able to help me uh, save my own life, so to speak. And then from a social justice issue, right? I really like to point out the barriers to care because I think as a society, we can do a lot better, especially as healthcare providers. So there's systemic bias that exists, whether it be racism, sexism, fat phobia, or ageism, right? Like you're too young to be having all of these things go on, right? I really think that all of those contributed to the level of diagnostic delay that I had, in spite of all of the access to healthcare that I had. And then I also think that insurance is just the bane of our existence as healthcare providers. And I really think that insurance-based care looks for reasons to deny treatment to people. And unfortunately, with insurance-based care looking to deny treatment, one healthcare provider's opinion could literally be a death sentence for patients with fewer resources. So, had I not had access to my boss, he could have given me a free MRI, and had I just taken the word of the neurosurgeon who told me I was essentially dealing with a psychiatric issue, I don't think I would be around to be presenting to you all today. So, I think it's important to know that insurance in and of itself is a barrier, and then the lack of awareness of these conditions obviously creates a self-perpetuating loop in which people are, I think, pressured as healthcare providers to come up with some type of answer. And rather than just telling patients, hey, I don't know what's going on with you, it becomes easier to just say, hey, like, there's nothing wrong with you. And so I think that uh, ends up being a self-perpetuating cycle that ends up being difficult for patients to get access to care. And if you ever want to contact me or get in touch, here's my contact info. And thank you very much for letting me share today. Let me just go ahead and stop sharing. Perfect.